Did the COVID pandemic freak you out and you're still not over it? So the last few years have been super weird and stressful. I think we can all agree. What a bizarre and crazy anxiety or depression inducing period at every level of society was the recently departed terrible COVID era. Some of us were damaged by this era physically, and some of us were damaged emotionally or psychologically or even spiritually. Some of us got over the damage, and some of us are still damaged and are suffering with emerging wounds as we move into the recovery phase of the pandemic era. Some of us never moved on into the recovery phase, and some of us just hate to even think about this stuff. We want it to all go away. Or we might be telling ourselves stories about having transcended it all, whilst still grappling with unnamed, unacknowledged negative behaviours or feelings. If you're still psychologically troubled by the COVID era, this might be showing up now as continuing distress or feelings of trauma, anxiety, anger, sadness, chronic demotivation, possibly a distracted, spacey, dissociated vibe, or just having trouble getting back into your life, getting traction back into your life. Or it might be showing up in metabolic, behavioural or physical problems like poor sleep, poor motivation, gut issues, or too many occasions of drug, alcohol, gambling, or the use of addictive technologies. And I'll just add here, if you're suffering with illness or injury after COVID, these illness or injury events might also prompt psychological challenges such as those listed just now. Okay, so let's talk about it. Pandemic trauma and amygdala hijack. Welcome back to Bite-Size Therapy with me, Jeremy, accredited psychotherapist with over 25 years of clinical experience. Bite-Size Therapy is a series of short-form videos in which I'm talking about or reflecting on ideas relating to therapy, counselling and psychology. And now seems like a good time to try and delve into COVID pandemic psychology, grief and trauma, as we generally find ourselves moving out of the acute pandemic phase and into the recovery or repair phase. So if you like this series or are interested to know more, please hit the like buttons, the subscribe buttons, all the bells and the buttons. I'd be grateful for that. And if you'd like to know more about me or my private practice, please follow the links in my bio or link tree. So now seems to be a good time to reflect deeply on why was it the way it was, and try to have a go at delving into that, delving into the motives and motivations, perhaps even those motives and motivations that lie partially hidden in the shadow realm, which after all is one of the fundamental purposes of therapy, in my humble opinion. That is, what are the hidden forces that run us? Let's bring that into the light, and therefore we can make the dysfunctional functional, or at least adaptive. So I can add to this point that I am seeing COVID trauma and grief and loss showing up in my clients and patients in my private practice. I'm also seeing manifestations of this stuff in my private life as well. And personally, I too am wrestling with coming to terms with all that happened in that wild and crazy and awful and terrible time. a conflagration of events that is certainly unprecedented in our lifetime, or in several lifetimes hence, perhaps ever, let it be said. So yeah, amygdala hijack is a concept that I hope might help us to understand the little t traumas and the big T traumas of the recently departed horrible COVID era. What do I mean by that? So an example of a big T trauma, for example, is death from COVID. Someone you know or love has died from the disease, or have got a lifelong injury as a result of long COVID, or perhaps were brought to their knees through losing their business or their livelihood due to the extended mega lockdowns and quarantine processes that shut down such large parts of our functioning economy and functional society. Or perhaps another example would be someone who has lost their ability to participate in their livelihood due to long COVID illness, for example. They're just not the same after the disease. So that's big T trauma. Examples of, actually before I go on, so some of these big T traumas may be prompting serious mental health challenges such as complicated grief or even post-traumatic stress disorder, which can be impossible to ignore. And I hope the concept of amygdala hijack, and more generally the evidence and hypotheses behind significant grief and trauma, can help us to understand the psychological etiology, which is a word to describe the causes and origins of a disease or illness or diagnosis, and the psychological squalene, which is a term to describe the consequences and results of a disease, illness, or diagnosis. So once again, I hope that amygdala hijack can help to understand the causes of psychological illness and the life cycle of psychological illnesses behind the serious adverse events of the COVID trauma pandemic era. So that's big T trauma. Little t trauma, I often describe little t trauma as what we might call the refrigerator hum anxiety in the background of your life, or the refrigerator hum depression, or dysregulation or emotional shutdown, from extended lockdown deprivations, from extended pandemic processes or policies, or the cycle, or the ongoing disease or illness, or the psychological and metabolic after effects of so much fear and so much anxiety, and the inability to access our normal coping strategies to deal with that fear and anxiety through the pandemic. So this little t trauma can sometimes be easier to ignore, as it is that kind of refrigerator hum process that's going on in the background that we can often just zone out, and we almost pretend or convince ourselves that it's not even there. It's just humming along in the background, nameless, faceless, partially hidden, but you know you feel something's not quite right. So I think, and I hope, that the concept of amygdala hijack that I'm going to explain in this series of, I think, 9 subsequent short form videos will help to pull some of this hidden stuff, this toxic hidden stuff, out of the darkness, out of the shadows, and into the light, so that we can analyze it and grapple with it therapeutically. And it might also throw some helpful light on the motives and the motivations of some of our behaviors, thoughts, and actions during the COVID era, particularly if we want to look back and think, what the hell was I thinking? What the hell was I feeling? What the hell was I saying? And what the hell was I doing? I don't recognize myself through the COVID era. So I hope that makes some sense. If interested, please check out and have a look for the next video in the series. Stay tuned for the next exciting episode, Danger 101.